Here in this video we'll talk about measles. It has three phases: prodromal phase, second is eruptive phase where you can see this rashes, and third is post-measles phase. Fever occurs on the 10th day, and on 12th day you can see this Koplik spots, which is very important. You have to remember in case of measles. You can see this Koplik spots, this whitish color, bluish whitish colored spots seen on the buccal mucosa near the second molar tooth. The patient can also present with cough, nasal discharge, red eyes, vomiting, diarrhea, just like the normal flu. The patient can present with these symptoms, but the specific day for fever is 10th day, and Koplik spots are seen on 12th day. What are Koplik spots? Whitish to bluish color spots appearing on the buccal mucosa near the second molar tooth. In eruptive phase, you have this eruption of this different rashes. There will be maculopapular, dusky red colored rashes. So first it starts behind the ear on the 14th day. Next day it just spreads to the face, trunk, legs, everywhere, and after some time it fades away, leaving some spots behind. This post-measles phase. So what happens here? There will be weight loss, weakness, and if the person fails to recover because of the low immunity, you can see this weakness, etc. So in the prodromal, 10th day fever, 12th day Koplik spots, and eruptive, you see this maculopapular red rashes. 14th day, you see this rash behind the ear, and the next day you just see it all over your body. Then slowly it fades away. And the post-eruption, that means post-measles, you see weight loss, weakness, and failure to recovery. Measles is caused by virus, right? So virus has this inclusion bodies. So multinucleated giant cells, both intracellular and intracytoplasmic inclusion bodies can be seen. Suppose this is a cell, multinucleated giant cells, which can be both intranuclear, that means inside the nucleus also you can find this, and also inside the cytoplasm also you can find this multinuclear giant cells inclusion bodies. MMR vaccine. So MR vaccine, measles and rubella. In MMR, you'll give for measles, mumps and rubella. In MMRV, you give for measles, mumps, rubella and the varicella. Varicella means for chickenpox. The first dose of MMR vaccine is given at 9 to 12 months of age. And the second dose of MMR vaccine is given at 16 to 24 months of age. First dose is given at 1 year and second dose is given at 2 years. It is given along with the vitamin A supplementation. It's derived from Edmonian strain. Live attenuated vaccine 0.5 ml is given subcutaneously. So it is derived from the human diploid cells. This will be toxic shock syndrome. MMR can cause toxic shock syndrome. It is very important even in the third year to just remember this. Toxic shock syndrome is associated with MMR. Now coming to contraindications. In which patients you do not have to give this MMR vaccine? If the patient is pregnant, if the patient has severe life-threatening allergic reaction, or the asthmatic patient, or advanced immunodeficiency state like TB or HIV, patients like this, you should not consider giving this MMR vaccine. And also active tuberculosis, which again decreases the immunity. And if any other live attenuated vaccine is given less than 1 month. Adverse drug reactions are toxic shock syndrome and mild illness. So this is about MMR vaccine and this is about measles. Again to summarize: prodromal, eruptive, post-eruptive. Prodromal, 10th day fever, 12th day Koplik spots. Eruptive, maculopapular red rashes, and 14th day rash behind an ear. Post-eruptive, weight loss, weakness and failure to recovery. So bye.